Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my YouTube channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for the continuous study. I hope you will make use of it. My dear friends, in the last class, we have been discussing about prioritizing the breast milk and creating some of the sustainable channel systems. So in the first part, we have described about the importance of the breast milk and why it should be the first priority and what are the benefits and all. So this portion we have already discussed in the first part. So today we will discuss this, how to create these sustainable channels or sustainable systems for the breast milk feeding. Now, one thing is very clear, that we have to understand the importance of the breast milk. Breast milk is not a simply a method of nutrition or providing the nutrition. It is a complete food. It contains all the essential ingredients. It's good for the immunity. It's good for the brain. It is good for the mother bonding. And it is also good for the personality development. This portion we have already covered. Now, how to create the sustainable channels? The fact is, preparation of the breastfeeding should not be started after the birth. In the sense, we have to prepare the antenatal mother, that is mother during her pregnancy period, when she comes to the antenatal visit. And that time is the right time for mentally preparing the lady for the future breastfeeding. And immediately after the birth, if everybody start telling her give breastfeeding, then she will be confused, and as she is not mentally ready. So with each antenatal visit, the doctor or the physician, attending physician, should motivate the mother for the breastfeeding. And same has to be done in the family environment also. The eldermost person in the family, so they should frequently advise the pregnant lady to prepare herself for the future breastfeeding by repeatedly memorizing her. And this will make her mentally fit for the same. And as we know, the breastfeeding is a hypothalamic, pituitary and mammary axis. So hypothalamic imprintation of this thing in the hypothalamus is very important for the production of the future hormones related to breastfeeding. This is one. Primary mother during the antenatal visit should be motivated and given training. Even she should be given training how to feed the baby. It is not the training which we will offer after the birth of the baby. No. So if you provide this training previously, maybe some of the videos if you provide how to feed the baby, how to hold the baby, okay. So if she watches one or two videos also, it is sufficient to mentally prepare her. So this is one thing. This is how we have to create the sustainable channel, number one. Number two, always motivate the mother for the early breastfeeding. Don't delay the breastfeeding immediately after birth. So once you delay, it's always a delay. Okay, so there are so many causes from the mother's side and the family side to postpone the breastfeeding. Suppose mother is delivered by cesarean section, or mother is a primary mother, or if the mother is having some other tiredness of this delivery and all. And most of the time what the mother says is feeding is not coming, so my baby is starving, so what can I do, please give outside milk. And even the family members will be also get melted emotionally by this, and they also start the outside feeding. Of course, it's actually confusing period actually. Okay, mother is not able to feed, and mother herself think that she is not able to feed the baby, and that itself is an emotional problem. And hypothalamus works basically on the emotional issues. So if the mother is depressed or emotionally upset, the hypothalamus stop working and feeding will be further reduced. So this is actually a confusing period. So we need to remove all the confusion in the antenatal period itself. See, this will happen. So these are the problems faced immediately after the birth. So, but you should not be panic. You should continue to feed the baby, because if you go on giving the feed, whatever may be the quantity, once you are feeding, that itself is the stimulus for the production of more and more breast milk by stimulation of the oxytocin and pituitary hormones, etc. So these factors has to be made understood to the mother during her pregnancy time itself. These are some of the early hurdles which can occur at the time of the pregnancy, at the time of the birth of the baby, but you don't panic, be prepared for it. This should be handled like this. This advice and motivation and training should be given to the mother during the antenatal period itself. And once they delay the breastfeeding, they have got number of causes for delaying the breastfeeding, then it is always a delay, and the proper breastfeeding, that mechanism will be get disturbed. So as early as possible, put the baby on the breast of the mother, whatever may be the quantity of the milk, whether the baby is, once you check the sucking, rooting and swallowing reflex of the baby, if it is all right, yes, put the baby on the breast. Okay, if the mother is giving only few drops of the breast milk, also in the initial phase it's called as colostrum, so that is quite good for the baby immunologically and other sense also. So this matter has to be made very clear to the baby, clear to the mother. This is very important. And without convincing her, without giving proper knowledge to her, if everybody starts shouting, give the breast milk, give the breast milk, and if you don't give, the baby will be starving, and this will create a lot of panic and frustration to the mother, and ultimately the production of the breast milk will be decreased. Third one is isolation of the mother and baby. Now this is a very important thing which is misunderstood. What Ayurveda says is you have to isolate mother and baby as a component from the others. But unfortunately few people separate mother and baby itself. Okay, this is not the right way. What Ayurveda says is separate mother and baby as a unit from others, so that mother will be given with a sufficient amount of privacy. She need to talk a lot with her baby, because since last 9 months she is very eager to talk to the baby. So we have to give a private environment for the mother and the baby to spend some time. So once a mother is able to express her feeling with the baby in privacy, that itself is one of the main factors for increasing the breast milk. So this also increases the maternal bonding and love, care, affection, everything about the baby, touch of the baby, smell of the baby, voice of the baby. All these factors are improving the quality and quantity of the breast milk. So therefore mother, this is another important system, sustainable system, where we have to create, which we have to create to increase the breast milk secretion and also feeding time. So that is isolation of the mother and as well as baby. So same has been also explained in Dolashana Samskara. In the Dolashana Samskara, till 12th day baby should not be put on the cradle. They say that on the 12th day we have to put the baby on the cradle. Indirectly this gives the message that you don't separate mother and baby for first 12 days. Keep the baby along with the mother, in touch with the mother, maybe on the abdomen or sides of the mother, so that the touch sensation, smell sensation and talking to the baby, so that plays a vital role in enhancing the breast milk secretion and establishing a proper lactation. That has been mentioned in Dolashana Samskara. Only after 12 days you have to shift the baby to the dola. The dola means cradle. Before that, keep the baby along with the mother. Don't separate them. Anyway, third one is one more important thing which creates sustainable system is home environment. Now home environment plays a very important role. In the home, everybody should understand this problem or importance of this particular issue, that they should be given a privacy. Okay, so there may be only limited rooms, but still you keep or reserve one room for the baby and mother, so that the privacy is maintained. And all the home members, family members should speak in a similar way. They should not confuse the feeding mother by telling different opinions or telling some of the panic things. Okay, it's not the time to frighten the mother. It's the time to support the mother mentally and psychologically. We have to emotionally we have to support the mother. We have to give her the assurance, and if she is doing any mistakes, we have to politely correct it. And it is not the way that loading the opinions on the mother. So home environment, a conducive home environment is very important. If the family members are support her, then definitely breastfeeding will be established. Now we should understand the fact that mother cannot feed the baby in front of everybody. Okay, because as I told, it is hypothalamic pituitary axis, and mother being cool, relaxed and happy. This is the first criteria to establish the proper feeding, because the hypothalamus works well only when the mother or even anybody is cool and relaxed. In the panic situation, in the frightened situation, in the tense situation, hypothalamus sympathetic activity will go into increase. So this is not good. Okay. So to keep the hypothalamus cool, we have to give her complete privacy, rest, assurance, etc. Okay, that is the responsibility of the family members. Now, one more important thing, sustainable system, is the night feeding. Okay, yes, night feeding is actually important because in the daytime everybody will feed the baby in the one or the other way. But usually what we'll see, we will restrict the night feeding. That means at 11 o'clock at night you are giving a feeding, then you're going for 5 o'clock or 6 o'clock in the early morning. In between usually we will avoid the feeding. Maybe mother is also sleeping. But actually the fact is we have to encourage the night feeding, because night feeding is important because the prolactin, which is responsible for the production of the breast milk, that will be produced in the night hours for the mother. Okay, now if the breast is emptified, then there will be more and more production of the prolactin, and there will be more production of the breast milk. Now most of the time for the night hours, maybe 6 or 7 hours, if the breast is full and it is not fed, it is not emptified, now negative feedback system is there which will go into restricts the production of the prolactin. So then naturally the breast milk production will be decreased. So to prevent this, go for the night feeding as far as possible. Okay, if you are not able to feed frequently, at least emptify the breast milk by extracting the breast milk and keep it stored in the fridge and all. So now this is very important. Therefore, we have to encourage the night feeding for the proper development of the lactation. The daytime, the production of the prolactin is not up to the mark. In the night time, it is maximum. So in the night time, it is maximum. So now you emptify the breast as early as possible, so that production of the prolactin is also more and production of the breast milk is also more. Next is we have to maintain the hypothalamic pituitary mammary axis. That means keep the mother cool and relax, keep away from all the tensions, and only baby care. Okay, let her conversate with the baby completely in privacy, so that she can express all the feelings. Okay, now next is hygiene and avoid the visitors. So this is the biggest problem. Maintenance of the hygiene is very important, but we know that, but we cannot convey this effectively to the visitors, because visitors, they are coming from the outside and they will come and touch the baby, okay, and disturbs the privacy of the mother, and that is also a big issue which interferes with the proper breastfeeding. So we need to be very little strict here. So one of the best ways is completely isolate the mother and the baby and keep them in a separate room, and entry to that particular room is restricted and only allowed after completely following the hygienic methods, aseptic methods. Completely maintain the aseptic methods. Of course, this is quite difficult, but we have to do it for the benefit of the mother. We should not disturb their privacy. Okay. If the visitors are coming, also they should leave the room in a short time. Anyway, the other thing is in the pre-checking of the breast. Now, very important, examination of the breast in the antenatal period itself, it should be done. Now, suppose the baby is having, mother is having some of the problems like inversion of the nipples, are not properly formed, tits are there, and so many other feeding problems are there. So if there is problem in the breast, so if that was identified pre-early in the antenatal period, we can take all the steps to correct it, and immediately after the birth there will not be any mechanical problems. Now most of the time what happens is the nipple problems, inversion of the nipple or eversion of the nipple, these problems will be identified when only the mother start feeding the baby. Instead that, if it is identified earlier in the antenatal period, we have got sufficient time to correct it. Okay, number one. Next, give two options to the mother. Yes, we need to play a psychological play with the mother here. Now, many times mother is worried about the weight of the baby, but unfortunately, in the first 2 years, nobody is worried about the intelligent level of the baby. So usually the mother, they will compare their baby with the neighbor's baby, neighbor's baby. So this is a neighbor's baby is of same age, but he is a little fat and heavy. That means hefty and stout. But my baby is very lean. They're more worried about the lean baby, or that is the weight of the baby rather than intelligence of the baby. But we have to convince the mother that those babies who are fed with the breast milk, usually they are lean and thin and active, but those who are fed with the other milk like animals milk and top feed etc., usually they are little hefty. But thing is, not the weight which is important in the first 2 years. Normal weight is sufficient. If it is low weight, yes, we have to take care. Normal weight is important. Making the baby stout is not our challenge or our aim. Making the baby more intelligent is our aim. Now you have to give two options. Do you want an intelligent child in future, or do you want an obese child in future? Okay, weight you can also increase even after that also, but intelligence you cannot increase after 3 or 4 years. The reason is the brain growth is maximum up to 2 years of age. 90% of the brain growth is over by 2 years. So only breast milk contains all the contents which is essentially required for the brain growth. If you start giving these materials individually, it is impossible. But God has given the gift that to increase the brain cognition, whatever the proteins etc., lipoproteins etc., which is required, that is abundantly available in the breast milk. And if you are not giving the breast milk in the first 2 years of the life, you are decreasing the intelligence level of your child. Okay, so now you have to give the option whether you have to increase the intelligence or you have to increase the weight of the baby. But unfortunately, everybody is concerned about the weight of the baby, but nobody is concerned about the intelligence level of the baby. And then everybody start after 3 or 4 years, my child is having autism, my child is having ADHD, my child is not concentrating. After 3 or 4 years or in the school ages, they come with other psychological problem. This would have been corrected in the beginning itself. Minor problems would have been corrected in the beginning itself if they are providing proper breast milk for 2 years. Okay, then educate the mother regarding the timing of giving the feed and fore, mid and hind milk. This is very important. Now, a lot of confusion is there among the mothers that when I have to feed my baby. Now, usually when the baby is hungry, baby start crying. This is one of the common logic. So when the baby start crying, you have to give the feed. And this is something like, suppose you want something and you are asking it with your parents, and parents are not giving you, and then you start crying. After crying, they have given that gift for you. Now what happens? Although you have received the gift, you are not so happy because they made you to weep, they made you to cry, so you are really irritated. The same thing occurs also with the baby. So when the baby start crying, you giving the feed. This is not the right way. What is important is you have to understand the hunger cues. Hunger cue means when the baby is actually really having the hunger, it will show some physical activities. A clever mother, skillful mother has to identify this. What is this? When the baby is hungry, so it shows some hunger cues. Now you have to identify these hunger cues. Baby start looking at the breast of the mother. Intelligent mother should identify that yes, my baby is hungry. Baby starts some of the lip movement. Baby do some physical activities, increase the physical activity of the baby. Baby is constantly looking at the breast of the mother. Okay, and eyes of the mother and breast of the mother. Then lip movement, physical activity. Then baby may put the fingers on the mouth. See, these are all considered as hunger cues. When the baby is having hunger cues, you have to give the feed. Then baby will be very happy. No, you are not identifying the hunger cues. Rather, you are leaving the baby, let the cry. And after cry, you understood that my baby is hungry. And you start feeding. Now baby is anyway, it is taking the feed, but it is not so happy. In between, it will leave it. It's just like our situation only. If somebody gives on first call itself, we will be very happy. Somebody make us to wait till 2 days and then they give that gift. Although we are receiving the gift, we are so happy. We are irritated. The same thing also occur with the baby. So sustainable system should be developed by educating the mother regarding the hunger cues. Okay, now educate the mother on foremilk, mid-milk and hind milk. This is also very important. Okay, so emptying one breast is important before going to the next breast. The reason is, suppose if you say the breastfeeding time will be total 20 minutes, the first 7 minutes the milk is called as foremilk, next 7 minutes the milk is called as mid milk, and the last 7 minutes is called as hind milk. Now importantly, interestingly, the composition of the milk in these three phases is different. The first 7 minutes the milk will have more carbohydrate and water, and it is very good to pacify the thirst of the baby. But the middle one, it contains more proteins, which is very important for the building of the body tissues. Last one contains fat, which is very important to increase the weight. Now suppose if you are feeding, the mother is feeding the baby for the first 7 minutes from the one breast, then she is shifting to the other breast. Okay, from the broad breast she is only giving carbohydrate and water rich food, milk, and baby will be pacified and baby will stop the feeding, because after taking the water and this carbohydrate the stomach is full, so it cannot take more. But it is not receiving protein, it is not receiving the fats. Okay, now suppose if you are not emptying, that means you are only feeding the baby for 7 minutes, baby stopped feeding and slept, you also slept. Okay, after half an hour baby again get up and again ask the feed, you are again giving the feed. Now in the first time also, for the 7 minutes or 5 minutes, you have given the foremilk, which is rich in water and carbohydrate, and after half an hour again the empty fat portion will be again refilled, and refilled portion is again carbohydrate and water rich, and again you are giving only carbohydrate rich food or feed. So this problem will be there. Mother should be educated on that. When you are feeding, you have to completely empty one breast. It takes about 20 minutes, 15 to 20 minutes. Okay, so mother can ask, sir, baby will sleep, what I should do? Awaken it, tickle it, awaken it, again make the baby to, so again make the baby to suck. So like that, once you have started feeding means you have to give it completely for 15 to 20 minutes, and you have to empty completely one breast, then only let the baby sleep. Okay, if you are doing like that, it is getting all the three ingredients, essential ingredients. Otherwise, if he is only having carbohydrate, most of the time only containing carbohydrate and water food, and ultimately mother start complaining that my baby is not gaining the weight. When you are not giving the protein, when you are not giving the fat, how can baby can attain the weight, gain the weight? Impossible. So this education has to be given. Educate the proper techniques and positive inputs, that's very important, and suitable environment, that is already we have discussed. Then family support and society support is very, very important. In the case of society support means, suppose if she is working mother, nowadays it's government policies that they have to have a proper breastfeeding room, a private breastfeeding room for the lactating mother. Okay, when she is having, or crèche, the situation, no, facility of the crèche has to be also provided. This is government has made compulsory. So society support and family support is very important. Then encourage the mother to take care of baby herself. This is very, very important. Most of the time what we say is mother herself think that feeding the baby is only my job. Looking after the other works related to the baby, like cleaning the baby, cleaning the diapers, etc., this is not my work, the ayah will do. No, this is wrong again. If you are involved in your baby care by yourself, so that again increase the maternal bonding. Okay, so your baby mother relationship and also maternal bonding. And one more thing is, when you are involved in such works, it also helps to burn your extra fats. However, extra fat will be burned by the breastfeeding itself, but the fat which is more accumulated in the antenatal period will be completely utilized for the breastfeeding and these works. So naturally, so mother will attain the proper body shape. Now this only emotional bonding will be there, and you will also do that work very neatly. Ayah cannot do this with so much of justification, but when you are taking care of your own baby, definitely you will not leave any lacuna there. Okay, you will be very, very particular. That's good. Then some of the compulsory workshop and training on the breastfeeding and baby care should be done during the antenatal visits, we have discussed. Mild music and white sound is quite beneficial. Mild music while feeding the baby or carrying the baby is good, and white sound. White sound is a sound which is for which baby is habituated for 9 months. That means with the baby is in the womb, uterus, there will be flow of the blood in the vessels. The baby is habituated for that. There will be some movement of the amniotic fluid. So these sounds will be there. So baby is habituated for these sounds. So even after the birth also, especially like breastfeeding and sleeping, etc., baby want this white sound. So if I say the fan, the sound of the fan, which is almost equal to white sound. Okay. No, absolutely. Therefore, in absolute most of the time you might have observed in the absolute silence, baby will not sleep well. But if the fan is running, then baby will have a good sleep, undisturbed sleep, and in the feeding also it is undisturbed. So this is the importance of the white sound. So you can have some white sound and mild music, okay, throughout the day in the baby care. And then yes, mother has to keep away the mobiles and all social media, because if the mother is feeding, in the meantime she is also looking at the mobile and reels and all, so she is not able to concentrate. The baby is watching your eye for maternal bonding. If you are watching the mobile, then there will be a lot of problems. So social media and other this mobile, etc., you have to keep away, keep aside when you are taking proper care of the baby. Otherwise these things will going to disturb you. And we have to create a similar environment of the uterus. Whatever the environment is there in the uterus, same situation you have to create outside as far as possible. About the unwanted handling and medications to the baby, then community education regarding breastfeeding should be given. Keep the marketing away. Okay, keep away the marketing and don't adulterate this holy bonding. Nowadays, infantile feeds are available. Only up to 6 months, don't give anything, at least up to 6 months. Possible up to 12 months, continue the breastfeeding along with the other feeds. Okay, but up to 6 months, only exclusive breastfeeding. Don't give any infantile formula mix. Now, social media impact, already we have discussed. Remove the misconceptions. There will be a lot of these misconceptions need to be removed in the antenatal period itself, not after the birth. Okay. Encourage the breastfeeding during illness. That is very important. The baby is having some problem like vomiting, maybe some loose motion, etc. First thing what we will do is we will stop breastfeeding. No. So you should not stop the breastfeeding. You have to continue because breastfeeding is the best milk during the illness. Because easily digestible, available in the normal temperature, okay, contain all the immunity factors. Then what do you need? Okay, it contains all the antibodies, immunity factors are there, so many antiviral factors, antibacterial factors are readily available in the breast milk. Then why you are refusing it? No, during the illness everything can be stopped, but breastfeeding should be continued. Okay, and we should not create a negative thought in the mind of the mother regarding breast milk. Suppose if the mother is if the baby is suffered with a lactose intolerance, usually breast milk contains high amount of the lactose, therefore child may develop the temporary or transitory lactose intolerance. Now that time you should not tell that this is because of the breast milk. No, give it in a small amount, but you continue it, because once you create a guilty feeling in the mother that my breast milk is causing problem for my baby, then for the next so many months the breastfeeding will get affected. So don't, although it is a cause, we know that it is because of the overloading of the lactose the problem is there. The rest of the things in the breast milk is very good. Only lactose is causing the problem. Okay, so you take measure to control it and correct it, but don't abuse the breast milk for all that, because breast milk contains so many other things also which is very important for the baby. Okay, so maybe in the breast milk jaundice or in the lactose intolerance, you don't create a guilty feeling in the mother that my breast milk is causing problem to my kid. If this feeling comes, then it takes long days, many days to come out of this feeling. Okay, then be careful about the educated mother. Nowadays, educated mother will have a lot of problems. An uneducated, our tribal mother, she is very keen to give the breast milk. She will not give anything other than breast milk. Of course, they have got malnutrition problem or nutritional problems. That's a different issue. But she is very, very fixed in her mind that I will only give the breast milk. But coming to the educated mother, they have got a lot of misconceptions. What happens, my body size and all those things. So you should be careful about the educated mother, not the uneducated mother. For the uneducated mother, once you tell, they will follow it. Okay, or by birth itself, they know that the tendency is there in the family. Remove the misconceptions, encourage the joint family system, because joint family, somebody will be there to give the tips. Nowadays what happens, the nuclear family, mother don't know anything. Okay, so she was kidded by her mother also. She don't know how to take care of the baby and all, and for every problem she will visit the doctor. But if you have in the joint family, the grandmother gives so many important tips to how to improve the breastfeeding. Okay, so these are all some of the important things which helps to create a sustainable channel systems for prioritizing the breast milk. Thank you very much. We will again meet in the next class.